Hi, I'm Shelly Cristobal, Doctor of Audiology at Hearing Healthcare Services. I am excited to help you get started hearing and get into your new hearing aids today. I'd like to go over a few things to help you understand the devices and the routines that will go along well with them. Hearing aids work best when they're worn the whole time you're awake every day. If your eyes are open, your ears should be on. So ideally, you will remove them from the charger when you wake up in the morning and put them into your ears. At the end of the day, you'll take them out and put them back in the charger. It's that simple. The only other times you will want to take them out of your ears would be if you're going to put your head underwater, if you're going somewhere that's so loud that you ought to use earplugs, or if you're getting a haircut, you probably want to take them out. If hearing aids are coming out of your ears at any time, they need to go into a designated spot. A pouch for your purse or pocket is a helpful spot to have for them. The charger, of course, would be their main home, but if there's a spot you kick your feet up in an armchair on Saturday afternoons to take a nap, have a safe place for the hearing aids to go right there, so you don't have to think about moving around to put them away. If you consistently go to the gym, have a case in your gym bag that's a safe place for them to go. It's wise to have a spot in the bathroom for when you hop in the shower, to have a safe place to tuck your hearing aids so that you don't have to run around and put them in their charger. You can continue with your routine. Hearing aids are tiny electronic devices. They are easily lost, easily misplaced, and so it's very helpful to have them only go into designated places or your ears. Your brain wants to receive the world in a consistent way, and we see with the research coming out that wearing hearing aids does help keep the auditory system doing what it should do, which is not a surprise. But what we also see is other parts of the brain don't have to work as hard to fill in the blanks or help support the auditory system when the hearing loss is treated. So wearing hearing aids the whole time you're awake every day means that you're not taking up frontal lobe, cognitive function, executive decision-making functions, balance, other things your brain is trying to do for you aren't being taken over in support of your hearing abilities. So you're going to wear your hearing aids the whole time you're awake every day. If your eyes are open, your ears will be on. And if your ears are not on, they'll be in a safe place. With what we're going through today, we have several user guides to send home with you. I will direct your attention to, there's a connectivity guide. We're going to put it in your folder, but typically on day one, we do not connect hearing aids to smartphones or iPads. You are more than welcome to play with this if you are confident working with the technology. If this is not something you feel very comfortable with, but you are looking forward to, just give it a few weeks. Once we're sure these are great hearing aids for you, and once we've gotten you a little bit more familiar with their use, we are happy to set this up for you and walk you through everything that it is able to do. But for now, just hold on to this. Also in your folder, you'll find a big user guide. It walks through everything under the sun on this entire line of hearing aids. So there is information on here about using your hearing aids in a classroom or in a top secret facility. All the FDA warnings and medical clearances are in here. It's not a thrilling read cover to cover, but if you are looking for an answer to a specific question, how to put it in, how to tell right from left, where does the battery go? It just beeped. What does that mean? There are nice little graphs that lay out and explain most of the questions that you may come across. So if you have a question, this is a great resource. This is your big user guide. I find our quick guide to be a little bit more practical. Now, this is one particular type of hearing aid, but the quick guide you'll find in your bag will be specific to the devices you are getting. We will have filled in details about your serial numbers, program settings, what the buttons do or how they're set up. Hearing aids with buttons, usually behind the scenes, we can set those buttons up to do a dozen different things. And so you'll want to refer to your quick guide where we've filled in those details to make sure you know how they are set. It also goes through the parts of the device, how to turn it on and off, basic functions with the charger, troubleshooting, what the beeps mean and what the lights mean. So pretty much everything you're going to go looking for is in this book here. There's also a user guide specific to the charger. This is how to clean the charger, things to look for if it's acting funny. You've got some resources there as well. We are also going to send you home with a hearing aid first aid kit. Typically we have some sort of cleaning cloth, a brush, like a small miniature toothbrush to clean off the hearing aid. And if you have filters, domes, any sort of pieces that can be replaced on the device, we'll send you home with a few extras. This is another one of those things that we're not going to go over today on day one. I want you to have these supplies in case something comes up. If you have any concerns or questions or something isn't working right, please call us. We can talk you through things to try using the resources in here. But our plan is to go over all of these details with you at either our first follow-up or our second follow-up, depending on how things are going. So we will go over all of this with you, but probably not today. You have all the pieces that you need there. So in your folder, you will find some business cards for the practice, as well as a magnet for your refrigerator with our phone number, so you can reach out to us if you need anything. We have walk-in hours available a few times a week. Those can be, we can see you curbside with you staying in your car, or you can come into the office if you're having concerns. It is helpful to call and let us know that you're coming, or schedule yourself a time block on our online scheduling system. We have a nice little thank you card and a brochure about our practice, as well as communication strategies, different strategies that help get the most out of your hearing aids. This is really geared towards your family members. And there's a brochure about adjusting to your new hearing aids from the company that has made them. Getting used to a new pair of hearing aids takes some time and some practice. Your brain has to remember how to listen for the things that you want to hear and how to tune out the things you don't want to hear. It takes the average adult 4 to 6 weeks of consistently using hearing aids to reach maximum benefit from them. So often on our day one, we may not send you home at all the sound that we ultimately want to provide for you. Many of our patients go home at 80% or even 70% of their prescription, their target level of sound. And over time, we build them up to hearing as much as will really be beneficial for them. But of course, no patient is a textbook. We know where to start. We know where the best place to work from is, but everyone's hearing needs and brain needs are unique. And so we will work with you over these next few weeks to help tailor the sound and get it adjusted just right for you. I do expect in these first week or two that things will sound weird. It's going to sound different than you're used to and possibly a bit noisier. It's likely to feel like there's something in your ear, because there is. Those sensations and experiences are very normal, and things we want you to give it a bit of time. Let it settle in. Louder than you're used to, different than you're used to, that's just fine. However, if you are finding the hearing aids are physically uncomfortable or are falling out of your ears, if the sound is too loud as to be uncomfortable, or if it's squeaking and squealing, or if it just seems like something isn't right, please give us a call. We do not want you to just get used to sore ears. We do not want you to get used to uncomfortable or overwhelming sound. We have a whole team here, 2 audiologists, an audiology assistant, and an office manager. Everyone's very happy to jump in and answer questions and help you understand what you need, and to make sure you get what you need as you're working through this adjustment process. So please don't hesitate to give us a call if you have any questions. Calls, emails, messages through the portal. We're happy to respond and make sure that we have you hearing as well as possible and getting you through this adjustment period in a way that's quite comfortable. We look forward to getting you connected and hearing again. Welcome back to the world of hearing. We're so excited to help you through this journey.